Peripheral neuropathy is treatable. Neuropathy is reversible. I'm about to inform you of a breakthrough medical protocol that is insurance and Medicare approved and has a great patient-reported success rate that is drug-free and non-invasive. The reason your previous doctors may have told you that your neuropathy is not treatable is because most doctors do not know how to treat it. For decades, doctors have been telling patients by pharmaceutical companies the only way to treat neuropathy and chronic conditions is with medication that you have to take every day for the rest of your life. This means you need to take medication every day so that hopefully you do not feel the pain and burning sensations that are caused by your neuropathy. In our office, we perform diagnostics and design a customized treatment plan to help you find the root cause of your neuropathy. Folks, I know your doctors have recommended medications such as gabapentin, Neurontin, Lyrica, Cymbalta, Tramadol, and we know you do not want to be on these for the rest of your life because they have side effects, and I don't blame you. What if I tell you some of these medications are anti-seizure medications? They gave them to patients to prevent seizures. We are not treating seizures. You know that. My name is Dr. Maz. I work with a panel of physicians at the Neuropathy Treatment Center of New Jersey, located in Bergen County. Our neuropathy treatment director is a neurosurgeon, is a surgeon who deals with nerves, who helps patients with a non-invasive, non-surgical, and drug-free approach that is insurance approved, Medicare approved, and FDA approved. If you want to get the quality of your life back, you need to let us know. If you want to be able to take walks with your spouse, play with your children or grandchildren, or engage in your favorite sport, you need to listen to what I'm about to say. If you want to be able to have a restful sleep without numbness, without burning, without irritation of touching your legs to the sheet, if you no longer want to be dependent on medication or even be able to walk around without fear of losing your balance, you need to pay attention to what I'm about to say. Let's talk about peripheral neuropathy. Peripheral means arms or legs, mainly below your elbows and below your knees, down to your toes. Neuropathy means your nerves are not functioning properly. The nerves are breaking down, they are degenerating, they are degrading and losing active small nerve fibers. Symptoms of neuropathy: pain in the lower legs, numbness, tingling, sharp pain, loss of feeling to hot or cold to the lower legs. We get patients from all over. Feeling your feet, they feel like ice. They feel tight. Feeling funny sensations in your lower legs like ants crawling on your feet. A lot of patients, they say that. They say, "Doc, I feel ants are crawling on my feet." Restless sleep, that's a biggie. Some patients report to us bed sheets touching their feet, they're bothersome. Many patients are unable to walk more than 5 minutes. Sounds familiar? Let's talk about your balance. Number one, balance issue is a common symptom associated with neuropathy. Number two, most patients do not accept that they have a balance problem unless it is detected by us or them. Number three, falls are the number one cause of death in the elderly population in the United States. Are you listening? If you fall, I cannot help you. You will wind up in a hospital facing many more other issues. If you want to prevent a fall, we can potentially help you and regenerate your nerves so you don't fall. The more active small nerve fibers you have, the less neuropathy symptoms you're going to have. You're going to feel less of neuropathy symptoms. That is what we do. Our treatment protocol stimulates, regenerates, rejuvenates, and revitalizes your nerve fibers. The problem is, many of you have had neuropathy and you have been told neuropathy is a normal aging process. Well, it's not. Many of you have been told the solution to your neuropathy is to take gabapentin or Neurontin for the rest of your life. That is not true. We have had many success stories. If you continue doing what you have been doing, how do you feel you're going to feel in a year from now? How do you feel you're going to feel in 3 years from now? 5 years from now? 10 years from now? I think you will agree that you will become worse and need more meds and potentially have fallen several times. Is that what you want? I have seen many patients who were on 7 medications, including gabapentin, Neurontin, Cymbalta, and they no longer take these medications because they finished this program. Problem number 2 is that your primary care doctor or your neurologist tell you there is no treatment for neuropathy because they don't know if there's a treatment for neuropathy. They're not aware of it. And you have been going to these doctors for many years. Well, it's not their fault because they don't know about this treatment program. They are taught in medical school that there is no treatment for chronic conditions and patients have to suffer and take these medications for the rest of their life. Maybe you're one of them. Our neuropathy treatment program, under the direction of a board-certified neurosurgeon, works and works well. Can we guarantee it? Absolutely not. Are we successful? Yes, very successful. Problem number 3. Some of you have had EMGs and nerve conduction studies by your primary care physician or by a neurologist for your neuropathy symptoms. Let me tell you something. These tests are outdated tests to assess neuropathy. You must get diagnosed and treated first. Why? Because we want to fix the cause of the problem. This is what we do. You have to have proper testing to get evaluated first to fix your neuropathy. We do on-site neuropathy severity exam, autonomic nervous system testing, vascular evaluation to assess the circulation to your nerves and to your legs. Some of you have neuropathy with circulatory problem. Some of you feel you have neuropathy, but it's just a circulation problem. Most people have problems with both. Treatment may include nerve block injections to reset the nerves to normal function, a specific therapeutic vitamin blend injection along the nerve fibers to heal the nerve and rejuvenate the nerves, which is 100% natural. The last but not least, our nerve rejuvenation system. It is a 20-minute, drug-free, non-invasive procedure that is FDA approved, insurance approved, painless modality, no side effects. This therapy produces specific frequency modulated electrical signals for nerve rejuvenation, for nerve restoration. By far the best result I have ever seen for treating neuropathy in 20 years. Let me tell you, I have neuropathy, and it has helped me after one session and I have tried other treatments. Most commonly, patients will ask if this therapy is similar to a TENS therapy. And the answer is no, it is not. TENS therapy is a $50 to $1,000 machine that numbs your pain for the day, which is not what you want. You are numb enough. That's why you're here. That's why you're afraid of falling. We don't want to numb your nerves anymore. We want to heal your nerves. We have invested on a $50,000 nerve rejuvenation system and protocol. It is a frequency modulated system designed for nerve rejuvenation and restoration and reducing chronic pain with electrical cell signaling technology. Well, what does this mean to you? Is that it's designed to fix your nerves that are causing neuropathy and reversing chronic pain, numbness, burning, tingling. This is the reason people from the tri-state area come to this office to see one of our physicians to get diagnosed properly and get treated properly. You do not want to mask your symptoms by taking daily medication. It will only get worse. Well, obviously. We see that every day. We want to find and fix the cause of your neuropathy. And yes, we have been successful in finding the cause and fixing your neuropathy. I'm just telling you how to do it. The decision is yours. Common conditions associated with neuropathy. First is diabetes and diabetic neuropathy. Then is chemotherapy-induced neuropathy, metabolic or toxic-related neuropathy, idiopathic neuropathy, which is a neuropathy without a known cause. You may have one of these, you may have none of these. If you don't feel your neuropathy is related to a specific condition, you are diagnosed with an idiopathic neuropathy. At this time, I want you to think about this on a scale of 1 to 10, 10 being fully committed and 1 being least committed. What is your level of commitment? What is the level of commitment that you have to get properly addressed and treated? I tell you, if you're less than an 8, this program is not for you. And we will not accept you as a patient if you're less than an 8. Because you must be committed to your care. Our level of commitment is 10 out of 10. To fix you, the patient. You can get treatment or not get treatment. It will not make a difference in our life, but it will make a huge difference in your life. We want to give your life back to you and your family. And this is a chance to get back to active life, the life that you deserve, the life that you want, and the life that you want to design for yourself. To see if you qualify for this program, you need to call 201-848-8000 and set up an appointment. When you come in, we will do our evaluation and we will inform you if you qualify for the program or if you don't qualify for the program. We only accept patients for care who we feel that we can truly help. And yes, we accept insurance and we accept Medicare. And God bless.